Hey everybody, it's Ethan. I'm a few days late on making my 5-month update. Um, yeah, about 4 days late, so sorry about that. Um, I made an update the other day, but after I rewatched it, it was a little all over the place, so I decided not to post that one. So I thought I'd make a list again and actually stay on topic, or at least make it more organized. Um, So for 5 months, not not any significant changes again in the last month. Still about the same with facial hair. Uh, Voice changes. I really haven't experienced like a deepening that I can tell. If it is, it's very small. But in the last week, my voice has kind of gone through some um, weird ups and downs. It's kind of it's cracked a little bit a few times, and um, just a little all over the place. So maybe that means some changes to come. I don't know. We'll see. So yeah, that's been one thing, and I've had a change in my sensitivity. Um, in the lower regions. I'm gonna leave it at that probably. Um, yeah, just uh, a little more sensitive than I usually am. So if you don't understand what I mean by that, don't worry about it. Just move past that one. Anyway, uh, mostly I have been kind of feeling stagnant. There really hasn't been a whole lot of changes going on, and so it's kind of I got a lot of changes up front, I think, and it's a little bit hard to be patient when I don't see any progress being made. But I also know that I pass the majority of the time. I haven't really been misgendered in a long time. I generally get gendered correctly, and again, still as a young, well, still as like a teenager. Although I think I'm creeping up into like the 19, maybe I could pass for 20 now, um, which is gonna be nice when I'm in like my 40s, but not so much right now. But yeah, so there's some there's some feelings of just not making any progress. I've considered maybe changing my dose, but obviously I don't want to do that until I talk to my doctor, so I haven't messed with it. I know I'm on a little bit higher of a dose than most people are, and that could probably account for like the initial changes up front, but my concern is if I'm on too high of a dose, I don't want hormones to convert back to estrogen. That would be sad. So I'm watching it. Um, there was a couple times where I felt at the end of my shot cycle like I had just run out of hormones for the last couple days. Like my body was just operating on nothing. Um, so I'm gonna watch that feeling. I didn't have it the last time, and I'm about to have another shot tomorrow. So and I don't really feel that way right now. So that's good. So I don't know. Nothing consistent on that front. But I might discuss changing my shot or my dose with my doctor. Um, we'll see. There's always a temptation to just do it on my own, but I know that's not safe. So I'll talk to my doctor before I do that. And then kind of something that I've been feeling too lately, along with the stagnation or just not feeling that there's any changes, is I've had a little bit of body image issues again, a little bit of dysphoria, I guess. In terms of my chest is fine, obviously I've had top surgery, but my hips have been an issue again. I haven't seen a whole lot of movement on fat redistribution in that area. There seemed to be a little bit about a month ago, but I haven't really noticed much lately. And again, I'm just getting back into working out. I keep saying that, but I am working out again, and maybe if I just be a little more consistent with that, I'll see some changes. But it was more, I kind of got triggered last weekend. Yeah, I think it was last weekend when I felt like I put on a pair of pants that I haven't worn in a while, and I felt like, I look like I still have hips, and it got me going. And then I tried on some other clothes, and I felt like I was seeing the same thing, and it just yeah, it's funny how you can kind of spiral really quickly downward just off of one instance. And after that, I kind of have spent this week a little bit in a weird place of feeling like I'm not passing with people, and I am. I was I was being introduced to this one guy the other day, and I mean, he just came up to me and said, "Hey, I haven't met you before. I was working at the farm that I've been working at sometimes," and he said, "Hey, man, I haven't met you before." So that was nice, confirmation that I do pass. But was he, when he was approaching me, I was like, "Oh man, this is like," I didn't really want to talk because I didn't really want to be introduced and have to go through the concern of maybe not passing with him at that point. But I do, and I think a lot of that can be contributed to having top surgery. I think when people are kind of scanning you, looking for gender clues, the fact that I don't have a noticeable chest anymore, even with binding, there was still something noticeably there. Yeah, I think that really helps in terms of passing. And my voice is at a pretty good place. I'd like it to be a little deeper, but it's actually good. And I can pass on the phone too, most of the time. So that's nice. Um, Other than that, I have been unemployed for a little while, so I'm actually applying for jobs again um, under my new name. And so part of the problem, though, is because I was in the military, my discharge paperwork has another name, has my old name on it, and inadvertently I'm going to be outed to my future employers. When a lot of times, if you indicate that you were in the military or you're a veteran, they'll ask for your paperwork. So I'm having to provide that, and it has my old name on it, and so I'm also providing my court order name change. So inadvertently, I'm having to out myself, which is something that I had already planned, but it just has thrown a lot. Um, I just put a lot in my mind of how I want to go about doing this with future employers, and also having left the army, trying to reach out back to some of my old bosses and let them know what's going on so they can be references. Otherwise, I don't have any references except for um, our local LGBT center that I volunteer at has offered to be a reference. The coordinator there has offered to be one of my references, but I need a little more than a few months' time of volunteer work being a reference, especially since my job history has all been through the army, and I have a lot of good experience that'll put me in position to get pretty decent jobs. But if I can't reach back to those references, it's going to be a little hard um, to prove that to future employers. So yeah, that has been an interesting navigation through that, and I've had some ups and downs with that process. Just yeah, it's created a lot of issues for me in terms of reaching back and putting myself in that mind frame of where I was as a woman, and coming out to people that I used to work with is proving harder than I thought it would be, and it's brought up a lot of feelings of I thought I was in a little bit better place in terms of accepting my past as being a woman, and I'm realizing maybe I'm not so grounded in that yet, which is fine. But yeah, I guess it's just been hard. I'm proud of the fact that I've transitioned and that I can you know, I can tell people that I'm trans, but there is still a weird, not weird, I guess, but there's still some issues with, yeah, reaching back into my old life and acknowledging that. So I'm working on it, but yeah, that's just something that has come up recently. Other than that, I guess I'll do a quick show of my chest. I am so bad right now, I can't even remember what, oh, how far out I am from surgery. It's just over 2 months at least. Yeah, 2 months would have been the 6th of August. So yeah, it's just over 2 months out of surgery. I'm using this new ointment on it. Hopefully that works. It was a recommendation from another trans guy. So we'll see how it goes. I'll let you guys know if it works out well or if it seems to be making any difference. It's called, hold on, I've got it actually. It's a 2-ounce container jar, and it actually goes really far. Smells like celery though, so you will smell like a vegetable, which can be good for joke material. But anyway, yeah, it's called Scar Melting Butter. See that? Yeah, and it's from Essential Elements. Their website's essentialelementssite.com. So if you want to look it up, yeah, one of my friends had good results with this, so I'm giving it a try. And I've been using it for about 2 weeks, well, probably 2 weeks now, and haven't noticed anything largely significant. But I feel like sometimes my scar seems darker or lighter depending on the day, time of day. I don't know. So I think really mostly time is going to be the best healer, I guess. Over time, scars will fade. So yeah, but anyway, I can try and help it along. Anyway, yeah, so here's the scar. It looks pretty good. There's still some irritation spots, and I think some of the stitches are still coming to the surface. There's another layer. I went into my surgeon about 2 weeks ago for a checkup with her at the 2-month mark, and she said that it looks like there is some irritation under the skin, but that should go away as all the stitches eventually dissolve. But it could take a couple months for all the internal stitches to go away. So yeah, that doesn't look too bad though. It's actually really flat. I don't have like very many raised parts in the scar, so as I touch it, it feels pretty smooth. But yeah, I mean, it's still kind of red. I don't know. Overall though, I'm happy with it. It looks good to me. I didn't have any dog ears, which is nice. And yeah, yeah, mostly as I start working out again, I'm starting to build a little chest muscle in here, but it's slow going. And I realized this past week has been a little rough on my shoulders. I think I might have jumped into some things a little too quickly, because I have felt a lot of pain in my shoulders and while I'm sleeping and stuff. So I'm watching that. It's not really related to top surgery, other than the fact that I didn't work out for over 6 weeks. So maybe a little bit gradual. Maybe a better approach would have been to gradually get back into working out. But oh well. I didn't. So I'm trying to ease into further workouts. But yeah, overall, I'm really happy with where everything is at. Still, the nipples need a little bit of help healing, but they'll get there. I know a lot is going to change over the next year with this, so just be patient, which is not easy, but I'll try. So anyway, yeah, that's it for 5 months. Again, I don't have any pictures this month. I should have some next month though. I might try for the 6-month mark to do some comparisons if I can. I wasn't very good on keeping up with pictures monthly, of progress, so might not be much to compare except for a a side by side of like 6 months and or pre-T in 6 months, and a voice comparison would probably be good too. So I'll work on that for next month. Anyway, take care, everybody. I will talk to you soon.